treat swollen turbinates. There are surgical and non-surgical ways to address turbinates that are enlarged. One way is medical therapy. This is with steroid sprays that you use on a daily basis, or other rinses that have steroids in it to help reduce that inflammation. The other way is surgically. You can do turbinate reductions. You can take out part of those turbinates. You can reduce them with things like radiofrequency. A lot of different ways you can address swollen turbinates to make them smaller. Do swollen turbinates go away? They may if your body is reacting to things like allergens or irritants in the air and you're no longer around those irritants or allergens. If you genetically just tend to have larger turbinates, this may not change that much. So it depends on the person and what is causing the swollen turbinates. In general, if they do tend to be big, you do need either medical or surgical therapy. Does Flonase shrink turbinates? Flonase does shrink turbinates. This does take time. You have to use this on a consistent basis. If your turbinates are large because you have allergies and you're reacting to things that are in the air, the Flonase will help reduce that inflammation and shrink the turbinates over time. What happens when your turbinates swell? In everyone, you have a nasal cycle in which one side of your turbinate swells and the other one goes down, and then it switches to the other side. So if you ever notice that you sometimes breathe better out of one side of your nose and then the other, that's completely natural, and that's something that happens in all of us. Some of us notice it more than others, and a lot of times when people who have a deviated septum or have trouble breathing will notice this more than other people. Your turbinates also may swell if you have irritants in the air, if you live in a place that has a lot of pollution, if you have a lot of allergies or things that would cause your tissues to react to the things that are in the air. What do enlarged turbinates feel like? They don't really feel like anything. They don't feel like anything's in there. They don't feel uncomfortable, but what they do feel like is congested. They feel like you can't get that much air through your nose, like you're stuffy, almost like you have a cold. And this is something that you would notice on a daily basis. If you just notice this sometimes, maybe when the allergies are bad, or if you have a cold, that is probably a normal reaction to your environment. But if you have enlarged turbinates, you just can't breathe very well through your nose most days. Have questions? Schedule a virtual consultation today at drangela.sturm.com. I would love to speak with you. Thanks for watching.